Hey everybody, this is Dr. Michael Shearer coming to you from IDS in Cologne, Germany, where we're spending a little bit of time with the new Trio 6 intraoral scanner. We've had an opportunity where we can go ahead and sit down in a clinical demonstration area where I've got the incredible aligner bee, Dr. Melissa Chotel, is going to be our demonstration patient. And what's really cool about this exercise is when I went to the release of the new Trio 6 unit, we realized that it's got some really incredible capabilities that allow us to go ahead and do comparative analyses of previous teeth. So it's more than just a hardware release. There's a lot of software and updates that are related to best management and analytics of our patients. So I have also in front of us some old scans from my own Trios unit back in my practice in California of Dr. Chotel's teeth from a couple years ago and several years ago that we're going to spend some time doing some cool analysis using AI as well as being able to figure out how to best use the tools that are in front of us. All right, everybody, let's go ahead and jump right in. Okay, everyone, so now that we've got our patient gone ahead and put into her proper position, we're now ready to go ahead and look at our intraoral scanner and determine the best features of what we can utilize with the new Trio 6. So kind of instantly when I take a look at the Trio 6, it's a wireless unit that's very compact, very much just like the Trios 5, with quite a few notable improvements. Notable improvements including a higher resolution. I've been indicated that it's approximately 110% more accurate in terms of scan quality compared to the Trios 5. In addition, it has hyperspectral imaging built into the tip, which is a combination of white, blue, and near-infrared light that allows you to do some pretty amazing and creative things with analytics associated with things like looking at areas of demineralization and then looking at analytics related to gingival recession, occlusal wear, and to go ahead and guide us on areas of concern that could be potential areas of dental decay. But it should feel very similar to what you've had in your hand with Trios 5, but if you're an existing Trios 3, Trios Core, or Trios 4 user, you are going to notice a big difference in weight compared to the previous generations as well. So I find the Trios 5 and now the Trios 6 is extremely light and extremely comfortable, very easy to scan with. So I'll go ahead and put this to the side, and also just like some of the Trios 5, it has a replaceable battery that I can go ahead and have multiple battery units that allows me to keep running throughout the day, which is pretty cool. Although one thing we are seeing here at IDS is some of the newer wireless scanners that have been released here at the show are now integrating their battery. So pros and cons of integration versus replaceable, I think they're both great options. You find out what's best for you. Now let's jump right into the scanning apps, which is arguably one of the coolest parts that's been released here by 3Shape at the IDS show. So looking at the computer system, I've got here on the screen in front of us the big version, and I have it right in front of my patient to go ahead and kind of show my patient and the ability right as an arm that positions over the patient, which is pretty cool here because here in Europe I don't have a chance to kind of use all these really interesting European dental chairs, you know, things with over the patient delivery, super high touch and beautiful setup. So it's just kind of a special thing for me as well. As we go ahead and we take a look at the traditional Trio scanner as well, I can go back to the home screen and we can see we've got a couple of her previous existing scans. One thing that's kind of cool about the new Trios releases here at IDS is we have some analytics and really interesting things that are related to looking at the patient scans from before to today. Things like AI-generated adaptive measurements of gingival recession, occlusal wear, and areas of dental concerns that we may want to go ahead and discuss with the patient, and things that are in a pictorial representation to go ahead and bring together AI into a system that actually makes sense. So I'm going to bring up the scan that we created for here today, open it up, and now let's go ahead and get started with our setting up our work order here for us today. And what we're going to go ahead and do in this particular aspect here is we're just going to go ahead and click on scan only. We'll leave the date here as today and then hit set, and now we're ready to go ahead and click on the scan page for Trios. And the first thing that we kind of notice in some of the software updates is a little bit of an update in terms of the icons and some of the different visualization. These are some of the things that really make the 3Shape Trios very interesting, is the usability of it. Okay, I'll ask my patient, how are we doing?
Doing great.
Good, ready to scan?
Absolutely.
Okay, great. So I've got some gloves off here to the side over here, so I'm going to go ahead and pop on some gloves. And now at this point we can also go ahead and grab out some of the one-time use or the replaceable tips. So I've got right here what they're calling a Trios Ready tip. So we can go ahead and open this up. It's in a sealed baggie. and this makes it very, very easy as well. And you can see here, this is single use only. It's got the kind of the 2 with the cross through it as well. But also as an option too, you have traditional trios tips that you can go ahead and reuse and re-sterilize as well. So both options available for us as the clinicians, depending upon the type of practice that you have. So I'm going to go ahead and take my existing Trio 6, pop off the existing tip, pop it over to here, and we're going to go ahead and take our Trios 1, which has the tip on here, and pop it on. And now once we see the green light, we're now ready to go ahead and scan. Additionally, we have the screen giving us a prompt, so that way it can give us a visualization of if the scanner is ready and what we need to go ahead and do next. So we're going to go ahead and take a moment, let that warm up, and now we're going to go ahead and get to 100%, and at that point we're ready to scan. Once my scanner is now warmed up, we're ready to go ahead and start scanning. Now this can be a solo-driven procedure. It has a very intelligent AI that allows me to go ahead and scan very easily using the AI filtering mode. Or alternatively, if I wanted to scan with a dental assistant, he or she would go ahead and help me by retracting, things of that nature. But since we're here at a trade show, let's go ahead and put the AI to the test as well. The Trio scanner has several different buttons. We have a scanner actuator button as well as an action button here on the end that allows us to very easily manipulate the scanner here as we work here with the Trio 6. My patient's all set. Let's go ahead and jump right in. Okay. As I click the button now, starting on the premolar, I'm going to slide distally and then swing buccally and just give it a little bit of a facial lingual tilt and then swing that across. And the AI looks like it's starting to pick up here already. I'll come to that distal edge right here, close down a little. There you go. You okay? Good. And swing back around here to that incisal edge. Now that we've completed the scan here, we can see that the mandibular arch scanned really easily. I think that was approximately just a few seconds. The intelligent software allows it to go ahead and scan extremely simple, extremely fast. That was pretty easy. How do we do?
Great.
Okay, good.
It's very comfortable.
Good. So now at this point I can go ahead and use the action button here on the scanner to go ahead and allow me to move the scanner around, inspect the different areas of the scan, and make it very, very simple here as well. Additionally, I can go ahead and click this exit remote button if I want to exit out of there, but you can also use the scanner itself as an ability to move almost like a mouse, so that way you don't have to touch the touchscreen or the tablet, and this really is very simple. Now, a lot of times I do like having a touchscreen or tablet in front of me because then it also gives the chance for the patient to go ahead and take a look here as we scan. But we're not ready for that just yet, so I'm going to go ahead and click on the exit remote button. And now we're ready to go ahead and move to the upper scan. I can click that with a button, or I can use the next button here on my intraoral scanner as well. Now at this point, we're ready to go ahead and start scanning on the maxilla. Same thing here on the premolar. Picking up that molar and just kind of sliding across. And then swinging the palate. And then the buccal. Go ahead and close a little. Close a little bit more. And close a little more. Sorry, there's going to be a buccal pinch back here. Close a little more. Swing that jaw a little bit. You got it. Okay. And open up a little. All right, so once I complete the occlusal surface, I'm going to swing here and just pick up the palate. And now a couple things that's very interesting, what I've noticed here about Trio 6 is when I hover in this area and just kind of keep in that position, it will have an opportunity where it starts to zoom in here on me as well, just like so. And this is simulating that you've got a crown prep or margin that you want to capture additional details here on it. So it does do it automatically. And then as you move out and move around, it'll change its position until you're finished with the scan. So now once I've completed the scanner is allowing me to go ahead and inspect the different areas of the scan. So we can click the button, finish the rest of the scan, or come back to different areas and inspect here once I'm done. So I'll go ahead and click on my remote button once the scanner has been completed and verify that the scan looks like it's complete. Now that I've completed scanning the maxillary arch, we're now ready to move on to the bite arch as well. So I can go ahead and click and move on to the next screen here as well, so we can start scanning the bite modes. Open and bite, open and bite down, and scan and squeeze. Takes just a few seconds to scan the bite. Now we can go ahead and scan the bite on the opposite side. And bite down. Now that I've scanned the bite, we're ready to go ahead and move on here to the post-processing mode here as well, and analysis. Once I click on the analysis page, give it a moment to go ahead and post-process, and we'll come back to look at some of the other features that are pretty cool here with Trio 6. Once my scanner has completed its post-processing mode, now we're ready to go ahead and take a look at it, and then we'll use our AI analytics with the Trios DX Plus mode that's unique to Trios. Beautiful. So overall, we're looking at the scan quality here, looking at the upper and lower, and we can see that we've got a very nice smooth scan quality here. We picked up most of the teeth here in very nice orientation, and I'm very happy with how it's post-processed here. The Trio 6 made scanning very simple. It's given me feedback on where I need to go ahead and touch areas up, where there's little areas missing, no problem. The scanner filled all of that data in, making this process simple. And that's really been the key of me working with my Trio scanner here over the years. Now at this point I can go ahead and remove my gloves, because now we're going to go ahead and simulate like we're working with the patient, showing our patient any areas of concern in the DX Plus mode. As I click the home button here on the scanner, I've already turned on the DX Plus or the Trios DX button right here. As I click that, now I can come into here and click the open mode and now start looking at the details of the scan. And what's really cool is that you can bring in previous scans from your Trio scanners as well to provide analytics from the patient from years ago. And that is really incredible. But if you don't have scans from years ago, no problem. You can also use the AI mode to go ahead and give you areas of things like areas of concern, like surface caries, tooth wear, recession, plaque, and areas of proximal decay or caries. So I can click on compare, inspect, diagnose, analyze, and present to the patient. So there's lots of functions that allow me to bring this right in front of our patient to go ahead and take a look at it. So whether we sometimes want to or not, or our patient wants us to or not, it's a great educational tool for our practices. As I click on surface caries, it's going to go ahead and bring up these little yellow buttons that we see right in here, and they look like little kind of just target marks, almost like occlusion marks. That's not occlusion, everybody. That's looking at areas of what would be considered kind of higher risk areas or areas of potential concern. So as I take a look at that, I can look around here. Overall looks pretty good. Now Dr. Chotel has some areas of sort of kind of hypermineralization or hypocalcification areas as well. And we can see here some areas of concern on the buccal, facials of her teeth, and things of that nature. As we look back here at kind of the tooth number 2 area, we would maybe want to go ahead and point that out to the patient, grab an Explorer, and do a measurement to see if there's any areas that have a cavitation in that area. I've gone ahead and taken a look at that with my Explorer. Dr. Chotel, no worries, cavity free. Good. But if she was my patient, my practice, not Dr. Chotel, I'd be like, okay, this is some areas that we want to go ahead and continue to watch. And this is not necessarily something that we would do in my side of the practice, but especially for dental assistants and hygienists in clinical practice. Imagine scanning the patient that comes in every time to go ahead and monitor the areas of decalcification, hypermineralization, or areas of recession of exposed root structure, things of that nature. And now as I go ahead and I click on enamel caries, I don't see any areas of concern in enamel caries. It's mostly picking up the areas surrounding some of that root areas as well. Now when I click on tooth wear, we're going to notice here we've got some areas of yellow that are indicating tooth wear according to what it would consider normal tooth. Now you can see here It's pointing out some areas of incisal edge, second molars, and premolars. Also down in here, incisor, molar, and things of that nature. But overall, doesn't look too bad. We do know as well this will be an opportunity for us to go ahead and talk with our patient about areas that are related to looking at the occlusion, the front, the back, looking at the teeth together, open, and possibly talking about a bite guard. So we know that both she and I wear bite guards, so no worries. That's already something that we've gone ahead and we've discussed here before, but this is part of the reason here too as well. Now, when I click on the recession button, this will be super cool because as I click on recession, it's going to give me areas that are related to areas that it would predict as where it would think there would be areas of recession. So notably, like right here in the molar or in the mandibular anterior, we see two lines as we zoom in here. Now the lines are indicating not comparing to previous scans with our patient, but comparing to norms. So if I click on that little area right in here, it's going to go ahead and give me the recession area in norm to what it would consider the norm of the tooth based upon averages. So it's looking like we have 0.45 or just under a half millimeter of area of potential recession to monitor with our patient. So we can see here we would talk to our patient also about potentially looking right in here. Now thankfully you don't have to worry too much about 0.5 millimeters of recession, but if we start to get into areas of 1, 2, 3 millimeters of recession, that's certainly a factor. So it gives you a little bit of a chart right in here of areas of severe recession, moderate, initial, or precursory or initial recession as well. If we click on the plaque button as well, we can see here that she's got really clean teeth here. Everywhere looks pretty good. Overall looks pretty good. Maybe, okay, hey, right here on the lingual of tooth number 7 or tooth number 10, maybe we talk about going for a hygiene appointment to clean this little area, no big deal. But across the board, everything here plaque-wise looks pretty good. Certainly something I would expect as well when treating a dentist also. But great job on cleaning your teeth as well, Dr. Chotel. Awesome.
Thank you.
Awesome. Okay, so now I can go ahead and turn off the plaque mode and click on proximal caries. So this is a really cool feature of some of this near-infrared and hyperspectral imaging that Trios is utilizing here with their Trio 6 scanner. It allows me to go ahead and zoom in on areas, giving me a really good visualization of areas of demineralization or areas of potential areas of decay to go ahead and show the patient. In addition to that is I can go ahead and turn on brightness and contrast and look at this in different orientations. And imagine this too, is I click on the little edit button and I can point out to the patient, Dr. Chotel, take a look here. We've got a really nice looking tooth here. Everything looks pretty good. Awesome. And then right in here, there's this one little area maybe you'd want to keep an eye on, take a look at, just a little bit of an area of where we see that little point in the tooth. Let's just clean that really well, no problem. And on top of that, I can save that and send that to the patient with the Trios app on their phone. How cool. Plus it also provides feedback on things like how to improve brushing, oral hygiene, and gives a report to the patient utilizing the Trios app. That part has got me super excited here as well. Now when I click on the present button, this allows me to go ahead and show the patient what your teeth look like before from your previous scans from a few years ago to today. And the good news is we're not seeing any changes. Teeth aren't shifting, you're wearing a retainer, yeah, brushing twice a day, flossing 3 times a day, 4 times?
I brush and floss 3 to 5 times a day.
This is true. All right, so now at this point here too, you can see there's all sorts of different features that gives us a simulation mode to look at where the teeth were before. I can click on play, very intuitive as well, making this very, very simple to go ahead and simulate as we're making a shift and looking at the teeth. I mean, that feature is really cool, everybody. Imagine you've got years of being able to look at teeth, or like in Dr. Chotel's practice with orthodontics, you can see how the teeth are changing and shifting over time, especially if the patient's looking at us saying, are my teeth really moving? Let me go ahead and show it to you in a playback mode. Wow, super cool. And then finally, as I click on the Analyze button, we can go ahead and take a look at these things, look at tooth shape, gingival shape. As I click this button, we can start to notice some of the areas of analytics between scans from before to scans today. So I've got a few scans in here from 2019, scans from 2022 in here. This is really incredible to be able to notice that really the gingiva and the shape of the gingiva is being preserved. We can see here also the tooth movement. Are we getting any tooth moving? Not even a smidge, so that's really good. And then of course here, tooth shape, and looking at the tooth shape and looking at things of like wear. Like right in here, we've got a little bit of wear right there on that plunger cusp on that second molar as well. Being able to also do all of these things, put notes in here, send this along to your patient. This is the cool stuff, everybody, that I really believe in. And this is also why I like touch screens. So Dr. Chotel, take a look here. You can see here across the board, especially if I look at gingival shape and I click on that. So you can touch the screen if you like. So touch it, move it around a little bit. Notice here the areas of yellow are indicating that's where you've had some gum recession. Notice I'm not seeing any progression of that 0.45 millimeters of gum recession that's on that one tooth. Everything is holding in there pretty good, so that's good news. Do you have any questions for me?
No, I think everything looks great.
Okay everyone, so now we've completed our scan, looked at the analytics side of things. This is also where it gets really interesting. We've completed our scan here on my demo patient, Dr. Chotel. She's done a great job, so thank you, Doc. Awesome. And now importantly, as well as I send you out into the world too, one thing that's really amazing is you have an iPhone app or a smartphone app that allows you to go ahead and give me the ability to send you the scans. Would you like me to go ahead and send you those scans? Awesome. I'll take your phone for a second because you've already had it loaded up on there. And what we can do is, as I can see right in here, you've got your scan on here now. Now, this is a demonstration scan here as well because we're at IDS, so these are Runa's teeth still on here as well. But I can easily bridge this scan to her phone as well, and I can show the patient what her teeth look like right in here. So gives you a preview. I click the next button. It's going to tell you those areas of recession that we talked about right in here. Well, it's got the teeth affected. I click the next button. It shows you the areas of wear, and here's the areas of the colors that we were telling you about. And then I click on the plaque button, some of the areas where we do need to be concerned about making sure that we clean really, really well as well. Click the next button, any areas of decay. Thankfully, we don't have to worry about it as well for you, and that's done. Plus, additionally, it'll go ahead and, if you need to ever reach our office, you can click on the call button, go to our website, set up your appointment on here. It'll link to our practice right in here, and then there's some additional reading on there if you have any other questions.
Excellent.
Awesome, thank you. So everybody, this has been a live scan demonstration here at IDS in Cologne, Germany, of our patient, Dr. Melissa Chotel. It's such an honor and privilege to go ahead and be back here at the 3Shape booth, where we kind of really have a lot of fun here over the years, demonstrating the latest in scanning technology as well. As you can see here, the Trio 6 is a really interesting scanner here at IDS. Lots of new features, but you can really see, especially once the scans have been post-processed, the level of detail of that 110% increase in quality of detail. And just imagine that you're showing your patient the areas of concern. What I love about what 3Shape is doing is the most important thing in my clinical practice, which is bringing the patient front and center. The technology is becoming a part of the discussion with the patient, not only in the dental office with the Trios OS software, with Trios, the touchscreen technology, but then also sending the patient home with that data utilizing the Trios app on their smartphone. Imagine your patients looking at you saying, "Doctor, what about this? What about this?" I've seen it over and over and over again in my clinical practice. It has been a growth center for me for being able to go ahead and do more dentistry. But then on top of that, especially for our patients in an implant practice or a general practice, we can follow our patients over time with our assistants and hygienists leading the charge with scanning. Finally, in cases like in Dr. Chotel's orthodontic practice, by being able to monitor the treatment of our patient over a few months with aligner movements and things of that nature, mind-boggling. So everybody, make sure you go ahead and check out Trio 6. This is Dr. Michael Shear. Stay tuned for additional videos here from IDS.